Hello, I'm Brian Zorn, one of the emergency medicine residents here at Brookdale University Hospital. Today we're going to go over your roles as an airway physician during a trauma. First, we're going to go over the airway physician role sheet that was sent to you as part of your orientation packet. Then we're going to go over the general layout of the trauma bay and where to find airway equipment. Finally, we'll go over some scenarios you might encounter and how some physicians may approach those situations. Okay, so now we're going to go over some of the equipment that's located in the trauma bay that we use in the management of trauma airways. So behind me, you'll see the trauma airway cart. This cart has the majority of the equipment you would use in the management of an airway in the trauma bay. It needs to be restocked at the beginning of every single shift. And most things are placed in order within the cart in order of use, starting from the top and going down to the bottom. Things around the cart that are of importance: you have BVMs attached on both sides. These are pediatric BVMs on this side, bag valve masks, and then you have adult BVMs on this side. You should also check to make sure that we have enough of those at the beginning of every shift. Up here, you have our oxygen supplies, dual oxygen supplies, one on each side. You should make sure that there's a tree attached before every shift and that they're working. Also behind them is our suction over here and over there. You should make sure that there is a Yankauer attached to the suction tubing and the tubing is long enough to reach the trauma beds. And turn them on, make sure they're working at the beginning of every shift. Restocking of this cart should be done at the beginning of the shift, and all of the supplies that you'll need for restocking are located at the back of the trauma bay in all of these glass cabinets. If during a trauma you need a piece of airway equipment that is not located in the trauma airway cart or is missing, we have airway boxes over here. There are two of them, and they have all the equipment you would need to manage an airway acutely. Those boxes also need to be restocked at the beginning of every shift. Generally speaking, those boxes are for management of airways outside of the trauma bay, but they can be used if you need supplies that are missing.
Hello, this is the voice of Sana Gong. You're looking at the roles and responsibility sheet of the airway physician. It's divided into categories of A for airway and B for breathing. Generally, you want to 1. Clear the airway. 2. Provide oxygen. 3. Obtain an oxygen saturation level. 4. Provide positive pressure when needed. 5. Establish a definitive airway if needed. 6. Confirm the airway if already intubated by paramedics. Other tasks include maintaining C-spine precautions, determining GCS, obtaining the ample history, assessing external signs of head trauma, and checking pupil sizes in response to light.
Hey guys, we have a 25-year-old male shot in the right lower leg. Vital signs are stable in the field.
Hi sir, my name is Dr. Gong. What's your name?
Matthew Ski.
Okay, I'm part of the trauma team today. I'm going to be putting on some oxygen for you and taking your oxygen level. In the meantime, I have some questions for you, okay?
Okay.
Do you have any allergies?
No allergies.
Do you take any medications?
No, I don't.
No medications. Do you have any other past medical history?
Just hypertension.
Okay. And what was the last time you ate or drank anything?
I had breakfast around 3 hours ago.
Okay. And what happened tonight?
I was just coming back from the store when a man pulled a gun and started shooting into the crowd.
Okay. Well, we'll take good care of you while you're here, okay?
Okay.
Guys, they just brought in this 80-year-old gentleman involved in motor vehicle accident, possible head trauma. He's minimally responsive and he was hypoxic in the field.
Hello, sir. I'm going to get an oxygen saturation on him. He's hypoxic on the non-rebreather to 88%. I'm going to start bagging him. His GCS is 6 and he's hypoxic. I think we should intubate, Dr. Vu.
Okay, I agree. Please set up for intubation.
Okay.
Guys, we just got this 35-year-old male ejected from a motor vehicle. Looks like he was unresponsive and had to be intubated in the field.
Dr. Vu, I think given his mechanism, we need to secure his C-spine before we do anything else. Dr. Stefanski, can you help me do that while I confirm his airway? The tube is in and confirmed. I'm just going to secure with the ET tube holder. Okay. Now let's put the seat collar on. For 1 second. Okay. Dr. Wu, I see a pretty big laceration and a contusion on this left scalp here, and his right pupil is blown. I think we should hyperventilate him and give him a dose of mannitol. I'm concerned for herniation.
Now let's go over some additional points and cases. When you're the airway physician during an ED thoracotomy, you actually want to intubate the right main stem. By only inflating the right lung, the left lung is down for the other providers to more easily access the heart to look for injuries. You also want to place an OG tube as soon as possible. An OG tube in the esophagus can help other providers feel the difference between this structure and the aorta if they need to cross-clamp the aorta. If the patient's oropharynx is too obstructed and placement of an orotracheal tube is impossible, a surgical airway may be needed. This can be performed by the surgery team if present or by yourself. Videos on performing a cricothyroidotomy are available on our website for review. After the initial evaluation of A and B, have frequent reassessments as the patient's status may change. A patient with an initially normal GCS but then a rapidly declining mental status may need a secured airway. Finally, be familiar with some of the differences between an adult, child, and neonate airways, as knowing the differences will help you prepare for a potentially stressful pediatric airway. We hope you enjoyed this video. Please see our website for additional instructional videos.